Good morning, everyone. And I must say my gratitude to the iBank Association of India for inviting me. And when we talk about the Bangladesh iBanking, the progress, challenges, and innovation, first, a little bit introduction about the Bangladesh. It's a country of South Asia, population, but it's a huge populated country is of 180 million, and we have the population rank of 8. It's a Muslim majority population. Our GDP per capita is USD 2500. And the eye health of Bangladesh, 1.5% adults are blind and 21.6% has low vision. 6 to 8 suffer from the corneal diseases. And primary eye care is available in all cities, tertiary eye care in the divisional cities. Total number of ophthalmologists, we have more than 1400 ophthalmologists. And now comes on the eye donation and eye banking. The first voluntary eye donation and cornea transplantation was done in 1976 in Dhaka, Bangladesh, which was done by late Professor Mustafizur Rahman. And first eye bank was established at 1982. It's more than 50 years. So the history has a long thing to say, but unfortunately, till now, the present scenario of Bangladesh, we have 5 iBanks approved by Bangladesh government, and in last 5 years, the total number of cornea transplantation in Bangladesh is nearly 3,000. It is mostly done by the private sectors, Bangladesh Eye Hospital and Islamia Eye Institute and Hospital. So what is the problem that divided in 1976 to 2008? By this time, what happened is that the unclaimed body, we have our high mortality hospitals and we could collect corneas from the unclaimed bodies. But we have some gadgets coming on. 2008 and 2018, the gadget goes on that the tissue transplantation system, they did not have clear instruction about the cornea collection, cornea harvesting system, so that after 2018, it getting low the collection process. But the thing is that when the local harvesting process is decreased, but our cornea surgeons, we have now 50 plus cornea surgeons, and we are getting all the corneas from US and Nepal right now. So the foreign cornea demand has been increased. And when there is the tissue needed and we are not getting the tissue, we refer patient to India or Nepal for the transplantation. And with the foreign tissue, what happened is that our surgeons skills becoming increasing because we are getting the pre-cut tissues. So we are regularly doing with the foreign tissues the PKP, DALK, and EK. But what are the demerits of this? The demerits for eye banking and cornea harvesting systems demerit for this is the functional eye bank established process is slowing down because we are getting tissues. The surgeons are getting a little bit relaxed because the logistics are here from the foreign corneas and no significant improvement over the years happening, and others are not interested for investing any eye bank. There no till last year, no stakeholders are investing for the eye bank in Bangladesh except the corneal surgeons. So I'm just, and another thing is that being the Muslim majority population, it's a little bit difficult to convince the Islamic leaders, but though we have all the data that Islamic Foundation and the World Muslim League has recognized and gave the fatwa that you can donate your eyes. There is no harm donating eyes in the religious view. So right now we are facing that religion view is not the problem. Our problem is the government gadget and the government recognition for the iBanking, start of the iBanking. And these are the thing that, so now the good part, that is the previous part before 2000 and 1976 to 2023. So we, the cornea surgeons and the other stakeholders from Bangladesh, we sat in a meeting and we decided that what we need right now for Bangladesh, starting the actual functional eye banking. We need the national guidelines for eliminating the corneal blindness, which is going on. Hopefully by next year, the Bangladesh government will publish it. And we need to involve all the stakeholders from a common platform with the government organization, NGOs, international NGOs, and the corneal surgeon and healthcare professionals, and the political and the religious leaders. Last year, we had several meetings with them, and sorry, and this is the result after having the several meetings. Mainly the corneal surgeons were involved for establishing the eye bank, but right now you can see the photos. We could establish a Bangladesh eye bank with the involvement of all the corneal surgeons in Bangladesh, and also the other stakeholders, not only doctors, non-medical stakeholders, and the religious and the politicians leaders who will work with the government for this. And Bangladesh government has now formed a committee for making the guideline for eye banking in Bangladesh. I am also part of this committee member, and after this we already started distributing the pledge forms, and it's going on, but motivation is going on. We need further work for that. And this is the present advisor of health in Bangladesh. We all the stakeholders of Bangladesh Eye Bank went to meet them, and the health ministry of Bangladesh is now going to help with us to recognize and establish the eye bank. But this is the thing, the instruction of things. But the thing is that this is still under process. We are still under the immature status. So to get the maturity in Bangladesh for eye bank, we will need time, and hopefully within few years, I will not say the next year, within few years we can give you a good information that we can collect, and through a proper system of cornea harvesting in Bangladesh. And by that time, I must say thank you to the Eye Bank Association of India and SightLife, Vision Share, and other stakeholders who are providing us the corneas, and Nepal Eye Bank, who are providing us the corneas so that we can continue our transplantation in Bangladesh. So right now, in last year, we did nearly 2,000 cornea transplantation in Bangladesh. Thank you very much.
So, any question by any Sujata? Yes.
Yeah, Dr. Ashraf, can you say how much cornea you get from which country? What is the proportion, just grossly,
Yes.
and how many you need?
Yeah. Basically, ma'am, their major cornea transplantation is done by 5 corneal surgeons in Bangladesh. So among the 5, 3 are working in one hospital and 2 working in another hospital. The 2 hospitals are working on, and we have the data. We need nearly 1,200 corneas per year minimum. And right now, the 80% cornea is we are getting from US, and 20% cornea we are getting from Nepal and Sri Lanka. So we have MU with Vision Share of US company and the SightLife, so that we are collecting corneas, and from last 2 years we are getting also the pre-cut tissues. So that's it.
So my next question is that do you have in this figure your own collection?
Sir, yes, we have our own collection till 2018.
No, last 5 years, no collection.
Last 5 years, we didn't have any local harvesting. But yeah, we did only 4 local harvesting in last 3 years. Because there was one girl who donated her corneas, that was 2. And we could collect from one actor's eye. So that was the only local harvesting corneas in last 3 years. Because the problem is that we set up the eye bank in 2013, but we have some multi-specialty hospitals where we can start the HCRP.
Right.
But the problem was the local government. When we started the HCRP, they told that we need to have the permission from the local government, but we didn't have the authorization letter. So that's why from last year, we are sitting with the government first. So give us the rules and regulation, because previously that was the think that the religious view people might not give the corneas, but
No,
it
that
has
is
been
not,
changed.
yeah.
It's a totally secular country, so it's not the religious view, it's the mindset up, it's the legal things, it's the publicity. So we are trying to do that from last 2024, and we already are working with the health ministry of Bangladesh right now.
So actually, I was going, you know, that
Yes.
several times to only for eye banking, and I have several times I did all life surgery there and
Yes.
lot of training, wet lab, everything we have done. Well, ultimately, there are several projects only supported by Rotary and all.
Yes.
We stayed there for 4 or 5 days, and somehow it didn't happen. My view is that we have an excellent guideline if you go to our website. So what is the medical standard of iBanking of India, and we have taken some from US iBank, some we have our local logistics. I believe that same logistic will be there, and your government also support those logistics in Bangladesh. So maybe the interim period you have certain problem, but once the things will cool down, I hope that
Yes.
that is the challenge, major challenge
Major
to
challenge,
cool
yes.
down the current situation. So we are hoping because I'm same mother tongue from Bangladesh, so I believe that what he said that it is right absolutely. The from inside their heart they say that we will donate, but there are certain logistic by the government and other sectors, so it is preventing them to donate eyes.
Yes.
Thank you
Thank you,
for
sir.
your.
Shamar Bashak sir is a big name in Bangladesh, and we all respect him. I still remember his one word that whatever you work, you first take the permission from your government. If your government is with you, you can work. And we are following your word, sir. Thank you. And definitely, we will take the help of IBAI, and we'll happy to take help from IBAI. Thank you, sir.